You're about to hear what doctors really think of seniors, the truth they whisper in hallways, but never say to your face. I've been in those rooms. I've seen the notes. And what I discovered left me furious. Behind the polished smiles and polite nods, there's a darker reality shaping how seniors are treated every single day. It's not just about medicine. It's about time, profit, and bias inside a trillion-dollar health care system. I've seen older patients rushed out of offices in minutes labeled as too complicated, not compliant, or worse, not worth the effort. And the most disturbing part, studies confirm it. Seniors are less likely to get life-saving interventions, less likely to be offered cutting-edge treatments, and more likely to be dismissed when symptoms don't fit neatly in the chart. This isn't guesswork. It's science hidden in plain sight. Tonight, I'm exposing the 5 ugly truths doctors really believe about older people. Some will shock you, some may feel painfully familiar, but when we reach number 2, you'll see the evidence that proves seniors in emergencies are treated differently. Abide is so real, it can mean the difference between life and death. Every reference I cite is in the description below. Don't take anyone's word blindly, not even mine. Go check the studies yourself. Before we dive in, here's a quick question. How old are you and where are you watching from? Drop it in the comments. I go through them myself, and your stories fuel these videos. Now, without any further delay, let's start with number 5, and it's one that quietly shapes every single appointment. Number 5, seniors are truth no. 5 seen as too complicated to treat. Doctors are trained to think fast, make decisions, and move on to the next patient. But seniors often come in with multiple health conditions at once: high blood pressure, diabetes, arthritis, memory loss, and more. Instead of seeing this as a normal part of aging that deserves careful care, many doctors quietly think too complicated. The research proves it. A 2018 study in the Journal of General Internal Medicine surveyed 500 physicians. Nearly 60% admitted they felt frustrated or overwhelmed when treating seniors with multiple conditions. That frustration matters because it changes behavior. Instead of digging deep, doctors often default to quick fixes: another pill, another referral, or a dismissal that nothing more can be done. This is called therapeutic nihilism, a fancy term that means doctors believe treatment won't really help anyway. For a senior, it feels like being brushed aside. Harold's 74 went to his doctor with chest tightness and fatigue. He was told it was just stress and to rest more. Only weeks later did another physician discover blocked arteries, the kind that can kill. The first doctor saw an older man with multiple health problems and assumed he was simply too complicated to treat aggressively. That decision almost cost Harold his life. Physiologically, complexity in seniors isn't a mystery. The body ages, systems overlap, and medications interact in unexpected ways. But instead of tackling this complexity with patients, many doctors cut corners. They skip advanced imaging. They avoid risky but effective treatments. They rely on safe medications that may not actually solve the problem. Over time, these choices create worse outcomes, higher hospitalizations, and a cycle of decline that could have been slow or stopped. The numbers are brutal. Seniors with 3 or more chronic conditions are twice as likely to have their symptoms misdiagnosed or ignored compared to middle-aged adults, according to a 2020 report in Age and Aging. That means the very group who needs the most care often gets the least accurate attention. And the unspoken truth is this: in many doctors' eyes, a senior is not a puzzle to solve, but a file too heavy to open. This ugly mindset fuels a cascade of missed opportunities, preventable hospitalizations, and early deaths. But if being seen as too complicated feels cold, the next ugly truth is even harsher. Many doctors see seniors as not worth the effort. Number 4, doctors' truth no. 4, many seniors don't follow prescriptions. Here's a number that shocks most people. More than 50% of older adults don't take their medications the way they're prescribed. That comes straight from the American Journal of Geriatric Pharmacotherapy. Doctors know this, and it shapes how they treat seniors. Instead of assuming compliance, many quietly assume failure. They write prescriptions but expect you won't finish them. They recommend plans but assume you'll forget, skip, or resist. And when they think this way, it lowers the quality of care seniors receive. Medication adherence, which simply means taking medicine exactly as directed, is complicated in older age. Pills pile up, side effects clash, memory slips, costs add up. For a doctor, it can feel like talking into the wind. And when doctors believe you won't follow through, they sometimes prescribe less effective treatments, avoid advanced therapies, or brush off serious conversations. The mindset becomes, why bother if they won't do it anyway? Dorothy, 68, was given blood pressure medication after a hospital visit. She struggled with the dizzy spells it caused, so she quietly stopped taking it. At her follow-up, she didn't admit it. Thinking she'd be scolded, her doctor assumed the drug had failed and doubled the dose. Within weeks, Dorothy fainted in her kitchen, ending up back in the ER. Her doctor's hidden assumption that she wouldn't follow through, combined with her silence, created a dangerous loop. Physiologically, skipping prescriptions has clear consequences. Blood pressure medicine skip can lead to sudden spikes. Diabetes drugs ignored can cause sugar swings that damage nerves and blood vessels. Blood thinners forgotten can make the difference between life and a fatal clot. And yet, instead of confronting the issue with empathy, many doctors grow cynical. That cynicism becomes a barrier between seniors and better outcomes. The science backs it up. A 2019 study in JAMA Internal Medicine found that seniors who admitted to non-adherence were 70% more likely to be labeled as non-operative or difficult in their medical melts. That label then influenced how aggressively doctors treated them going forward. In other words, once your tag is someone who doesn't follow prescriptions, your care may be forever downgraded. The ugly truth here isn't that seniors struggle with prescriptions. It's that doctors expect it, and instead of solving the problem, they lower their standards. That quiet, unspoken bias can be deadly. And if you think being seen as non-compliant is bad, wait until you hear what happens when doctors start treating seniors as if their pain doesn't even matter. Before we move on, tap that like button and subscribe. The most shocking part is still coming. Truth no. 3, number 3, doctors believe seniors hide too many symptoms. Picture this. A 70-year-old woman walks into her doctor's office with a smile, saying she feels mostly fine. What she doesn't mention is the chest pressure at night, the tingling in her hands, or the dizzy spells that scare her. Doctors see this pattern all the time, and it's left many with a blunt assumption. Seniors hide too much. Instead of open books, they're seen as puzzles missing half the pieces. The science backs up that perception. A 2021 study in the Journal of the American Geriatric Society found that nearly 45% of older patients admitted to withholding symptoms out of fear, embarrassment, or not wanting to be a burden. Doctors know this, and it changes their mindset. They don't always trust what's said in the room. They suspect more is hiding beneath the surface. And when suspicion replaces trust, care can turn cold. George, 73, felt occasional shortness of breath, but never told his doctor. "I don't want to waste his time," he said to his daughter. When he finally collapsed while walking the dog, the ER revealed severe heart failure. His silence wasn't laziness. It was fear of being brushed off. But to the doctor, it confirmed the stereotype. Another senior hiding too much until it's too late. Physiologically, hidden symptoms are dangerous because the body in later years has less resilience. A skipped mention of vision blurriness might be the first clue to diabetes. Not admitting bathroom struggles could be the earliest warning of prostate cancer. A forgotten note about numb toes might reveal poor circulation heading toward amputation risk. When seniors don't share, doctors don't act. And when doctors assume seniors are always hiding, they sometimes push less, investigate less, and end up missing the chance to prevent catastrophe. The numbers prove the cost. Seniors who underreport symptoms have a 36% higher chance of hospitalization within a year, according to a 2020 report in Health Services Research. That means what's left unsaid in the office often leads straight to the hospital bed. The ugly truth is that many doctors believe seniors hide too much, and instead of digging deeper with compassion, they often lean into frustration. That frustration translates into fewer questions, less patience, and missed opportunities for early treatment. And if you think being seen as secretive is bad, the next ugly truth is even colder. Some doctors believe seniors simply don't value their own lives the same way anymore. Number 2, doctors worry about truth no. 2 time, and seniors take the longest. The average primary care visit in the United States lasts just 18 minutes, according to the Journal of General Internal Medicine. That's the entire slot. History, questions, exam, prescriptions, and goodbye. For seniors with multiple conditions, memory concerns, and long medication lists, 18 minutes is never enough. Doctors know it, and many resent it. Quietly, they see older patients as time drains. And in a system where time is money, that bias shapes every interaction. The reality is obvious in practice. Seniors talk slower, recall symptoms in fragments, and often need more clarification. Many bring lists of medications or even bags of pill bottles. For a rush doctor, this feels like a ticking clock, and instead of slowing down, many speed up, cutting off explanations, rushing through diagnosis, or skipping preventive care altogether. Mildred, 76, walked into her appointment with swollen ankles and shortness of breath. She wanted to explain everything from her diet to her medications, but she was interrupted twice and shuffled out with a new water pill. 2 months later, she was hospitalized with advanced heart failure. The rush visit missed the full picture, and the system's time pressure turned her body into collateral damage. Physiologically, seniors need more time because the body's signals overlap. Chest pain could be heart disease, but it could also be lung scarring or even acid reflux. Fatigue might be thyroid failure, anemia, or medication side effects. Sorting through these requires patience. Without it, doctors default to surface-level fixes, often missing the deeper, deadlier cause. The numbers confirm the damage. Seniors seen in shorter visits have a 25% higher rate of misdiagnosis compared to those given longer appointments, according to a 2019 study in BMJ Quality and Safety. Yet, in the pressure cooker of modern medicine, longer visits are rare luxuries. The ugly truth is this: many doctors worry more about their schedules than their seniors' lives. And when time runs short, it's the older patient who pays the price. But as harsh as that sounds, the number one ugly truth is the most shocking of all, and it exposes exactly how doctors decide who gets help in life or death emergencies. Truth number one, doctors know age bias is real. This is the ugliest truth of them all. All age bias in medicine is not just suspicion. It's proven, it's real, and it kills. The polite word for it is ageism. But stripped bare, it means doctors make decisions differently for older patients than for younger ones, even when the symptoms are the same. The data is brutal. A 2020 study in The Lancet analyzed emergency care in seniors. They found that patients over 70 with chest pain were 22% less likely to be given life-saving interventions like stances compared to middle-aged patients with identical symptoms. Another study in JAMBA showed that seniors with aggressive cancers were 37% less likely to be offered clinical trials, shutting them out of the very treatments that could extend their lives. The science doesn't lie. Age bias is alive inside hospitals. Elmer, 79, arrived at the ER after fainting. The staff noted her age before anything else. Instead of rushing her into advanced imaging, they gave her fluids and sent her home. Weeks later, she collapsed again, this time of the massive stroke caused by untreated carotid artery disease. To her family, it was betrayal. To the hospital, it was just another old patient whose decline was expected. Physiologically, age doesn't make treatments less effective. A stent still opens an artery at 75. A clot-busting drug still works at 80. Radiation still kills cancer cells at 85. But age bias makes doctors hesitate, delay, or dismiss as if years live make life less worth saving. This silent discrimination means seniors walk into hospitals already fighting even before the diagnosis begins. The ugly truth is that many doctors know this bias exists, and some even admit it shapes their choices. It's the quiet calculation of resource versus reward hidden under words like quality of life or risk of complications. But behind the jargon is a darker belief that older lives simply matter less. And this is why seniors need to be aware, because when you know the truth, you can demand better. Age bias is real, but it doesn't have to decide your future. Now you know what almost no one will admit out loud. The hidden thoughts doctors carry about seniors. The 5 ugly truths are not rumors. They're real. They're documented. And they affect millions of lives every single day. Seniors are seen as too complicated, as if the richness of a lifetime of health history is an annoyance rather than a roadmap to better care. They're labeled as non-compliant the moment they struggle with prescriptions without doctors pausing to consider the costs, side effects, or confusion of juggling 10 different pills. They're accused of hiding symptoms when in reality, most are simply afraid of being dismissed or treated like a burden. They're rushed through appointments because time is money, even though older bodies need more time, more questions, and more listening. And worst of all, they face the cold edge of age bias where life-saving decisions can shift based on nothing more than the date on your birth certificate. Think about what that means. An older man with chest pain might get fluies instead of a stent. A woman with cancer might be excluded from trials that could extend her life. A senior fainting from a clogged artery might be sent home with rest and hydration while the real cause is ignored. Age bias is an abstract. It decides who gets treated and who doesn't. It decides who lives and who dies. And it is happening every day inside a healthcare system that claims to do no harm. But here's the other side of the truth. Awareness is power. When you know these biases exist, you walk into the doctor's office differently. You ask sharper questions. You bring notes, records, and a witness if you need to. You refuse to be brushed aside. You demand the same urgency, the same respect, and the same chance at life that younger patients take for granted. Because the science proves one thing beyond the doubt. Treatments don't stop working at 60, 70, or 80. What stops working is the system's willingness to offer them, and that's where you fight back. Every senior watching this deserves to be heard, respected, and treated as if their years make them wiser, not weaker. If anything, your age should make doctors fight harder for you, not give up sooner. But that only happens when you refuse to be silent. So here's my challenge to you. Share your story in the comments. What has been your most frustrating or eye-opening experience with a doctor after 60? I read every single one because your voices matter, and the more we speak up, the harder it becomes for the system to ignore us. If this video hit you hard, hit the like button so more seniors see it before it's too late. And make sure to subscribe because we're not done pulling the curtain back. The next video will expose even more truths about health after 60 that could save your life. You deserve answers. You deserve respect. And you deserve the chance to live every year ahead with strength, dignity, and clarity. Never let anyone, not even a doctor, make you believe otherwise. If you've experienced this yourself or have tips to add, let us know in the comments. Thanks for watching.